All right, good morning. So here I am at Coronavirus Central again. So I'm actually at my office here at LaSalle University in Philadelphia, where I'm doing these daily updates on coronavirus prevalence. Actually, it's COVID-19. This is the novel coronavirus, if you want to be very, very specific about it. I still have my highlight of China versus Italy. This is not a volleyball match. This is actually a prevalence, and you'll notice I have here prevalence per 100,000. So I know it looks like a division, but it's easier for me to just use that slash there. This is prevalence per 100,000. So to calculate prevalence, dividing that. Now I have two values here now, which in the past I only had one. So one is the ever cases. So up to yesterday, I was doing prevalence only because I was worried about our accounting of how many people are active and how many people are ever contracted this COVID-19, right? So I have prevalence. So prevalence is current cases. So what I'm dividing active by my best estimate of the population. So here I'm using this worldometer, which provides population data. Those are the best guesses. You can't be perfect because people keep on dying and being born all the time. And as you may know, let me see if I have this available. I'm using this John Hopkins coronavirus map in order to track the number of cases. And this is an awesome site because it pulls from World Health Organization, CDC, and other agencies to get the latest number of cases and then deaths and how many people have recovered. So as you can see, this is total deaths worldwide. We have 4,717 deaths worldwide. And I've been listening to the radio, and I listen to different shows in the morning, and I even looked up the number of deaths for the seasonal flu in 2020. So this spans 2019 and 2020, this coronavirus, and we pale in comparison to the number of deaths in the U.S. So you can just look that up. Flu deaths USA 2020. We could hopefully get a reputable source up here. Let's see. If we could find the CDC, would be great. Here, CDC. Do we have anything? Deaths. Well, this is actually from October 1, 2019 through February 29. 20 to 52,000 deaths. And you have 34 to 49 million people infected. So let's compare, this is in the US, right? So let's compare this to what we're seeing with the coronavirus worldwide. I want you to understand that there is a difference here, and I'm not trying to belittle what's happening with the coronavirus, but the flu has killed a lot more than 4,717 people. Just keep that in perspective. So I'll do more on that later because I want to look through those data. Why are they giving us a range of deaths? So I need to. This was just on the fly, very quick look at that. But the flu is killing a lot of people in raw numbers, so it's putting a great burden on our healthcare system. Just a sheer number of individuals who have it. But let's stick with what we're doing here. So there's two different numbers here. I'm looking at the prevalence. This is the number of active cases divided by the population. So, and then I multiply it by 100,000 to put it in perspective. Otherwise, we'd be dealing with these really small numbers here. This is P for the probability. If we want to know what the probability of somebody having the coronavirus is, we just use this proportion as our estimate of the probability. Q in this case is equal to 1 minus P. So that's the probability of not having the coronavirus. So if we look at it per 100,000 right now in China, you'd find one person per every 100,000 individuals with the coronavirus. I put India here because India is a relatively large country. This is the population size. It's over almost 1.5 billion in China and close in India too. They have very few cases now. That could be that it's poor reporting, or it could be something else. I don't know yet, but it's very low in comparison. Get to the U.S., which we're all interested in right now. There's 0.39 cases, not quite a half a person yet per 100,000. Iran is 6.77. Italy, though, it stands out for being 17.5 per 100,000. And I've been trying to understand why this is. And it's really complicated, I suppose. Most of it is located in northern Italy, where there's a lot of tourism. That could be it. I was in where was I recently? I was in Italy recently, and a couple of years ago, and it's beautiful. But you do get a lot of tourists from all over the world. That could be one reason. There could be a lot of cultural factors, like people touching each other a lot, hands, eating. I don't know what it is. South Korea, you had 14.57, so that's pretty high there too. You go down to, and the reason I have Austria, Switzerland, and Slovenia is I'm looking at bordering countries. So Switzerland, I can see why there's this travel ban right now. Okay, but again, these are small numbers out of 100,000 people. Remember, it's out of 100,000 people. You'll find 7 in Switzerland. In the United States, I added a couple of states from yesterday. We had California, which is less than a half a person per 100,000. You can still do 100,000 because these populations are very large. Pennsylvania, it's about a tenth of a person, a little bit more than a tenth of a person. New York, about 1 person per every 100,000. And Washington State, we had the most. We also had the most deaths in Washington State. Most of those were in a nursing home. So this points to the vulnerability of people who have some kind of underlying health condition or the elderly. I would be very concerned about people who are older. I wouldn't want to visit a nursing home right now at all. And I've been tracking this difference. This is a difference in the prevalence between Italy and China. It's like the difference is like 16. Well, you can see it right there, right? It's 16.48 people per 100,000. Something is really wrong in Italy. That's all I can say. Even more so than China. And if we look at ever, I mean, the difference is 20. It's 15, about 15 individuals difference per 100,000. So again, Italy, something is wrong. Whatever they're doing, we don't want to do it because it didn't work. So I'm not saying that it's going to be like this in the U.S. I know a lot of people who are very panicky right now. They're very, very panicky about this. In fact, I'm calling this it's my coining my new term. Let's do a hashtag, right? Hashtag panicdemic. So we have this panicdemic going on here. And yes, you should be worried. You should be concerned, particularly if you're showing symptoms. Go to your healthcare provider. Understand the symptoms. This seems to be very lower respiratory, more than upper respiratory. Understand the symptoms. Don't put yourself in situations where there's a lot of people. Like I wouldn't go to any gathering that has 1,000 people or 200 people. Stay away from those for a little while. But should you alter the rest of your life because of this? H1N1 was more serious than this. Affected way more people. I'll look into it and provide you some statistics in comparison in one of the future broadcasts. But we will overcome this. Panicking is never good. If I was in battle and I panicked, I'd probably get killed. In a war, you just like give up and you get killed. If you can stay calm and follow the right protocols, you'll probably survive. I mean, look at the deaths that we see here. We've had 38 deaths in the United States. I didn't put all the states, like Florida, we had some deaths too, and I think one in New Jersey. We had 38 deaths in the United States. I mean, the chances of you dying from this disease are very low. But be cautious. Wash your hands liberally, 30 seconds with soap and water. Hot water, don't burn yourself, but warm, hot on the hotter side, water. 30 seconds, wipe your hands. Grab a clean towel after you've wiped your hands to open the door if you have to open a doorknob. Have hand sanitizer available. Just practice. Be safe. Don't eat with your hands if they're not washed. But you should be doing this anyway all the time, so we could prevent the flu, etc. Maybe next year, this novel coronavirus will be included in our flu shot, and everything will be cool. Get your flu shot. So just be wise, and thank you for paying attention, and let's not spread the panic-demic. All right, thank you again for listening to me. Bye.